Okay, thanks. We can keep going, keeping an eye on being recorded. Yes, I think we're okay. Welcome, everybody. Thank you for coming.
No, she's.
Oh, she's saying no. Oh, I thought she said we could go.
She's giving you the finger of wait.
Okay. Now I'm worried. We'll try again. Okay, we're good. We're being recorded and all the rest of it. Thank you for coming, everybody. We have a couple of meetings tonight, but quickly, on a call to order, just to let everybody know for the record that Glenn and Cody are excused with reason. They told us they couldn't come. Jay Lee has asked if she could be on site with the computer. We'll see.
Not yet, but she should be very shortly.
So that could work too.
Yep, she's got all the information, so she should be on shortly.
Thank you. That was arranged at the last minute, so thank you for doing that. Other than just quickly go through, if you would, Richard, starting with you, just to.
Sarah Chamberlain.
Paul Oline?
Fred Rulerman.
Frank Ellerman.
Ted Dobert.
Thank you, folks. Are there any, other than the speakers tonight, and we have with us the liaison from the council this evening, which would be very nice. Would you like to say something?
I think you're just watch today. Really not much to report on today.
You want to come up? No? No? Okay.
Say what you just said, just in the microphone.
Adam Reynolds, Town Council. Just really here to observe. Not too much to report on right now. We're just going back out to re-vote on the Board of Ed budget, but the Town Council one on the town side passed, so we're just waiting for that vote on the 9th. So make sure everybody comes out and votes.
Thank you. Thank you very much. Is it on? There's a little button. Just,
Hello. Okay.
Oh.
Hi, Jocelyn Birdie, 125 Lake Road in Dayville. I got the survey and participated in that you guys had put out. And I just want to throw out there, like I've spoken in front of you guys before, about activities for, early teens and teens or kids, something to do other than just, hang out at the library or go to Owen Bell Park. And unfortunately, I heard that the splash pad's closed right now due to some issues. But one thing regarding the splash pad is maybe you guys could look into it and bring other committees together on it. Is there's no shade near the splash pad or at Owen Bell Park, like at all. So, moms that have little kids that bring their older kids, to play at the park and stuff, there's not a lot of shade. And it gets really hot there. So that just might be something to look into. But yeah, I think we just need a lot more of activities, whether it's family-based or just for kids, without parents, having to be involved. Just something for the kids and teens to do to, keep them out of trouble, keep them busy, keep them, from getting bored this summer. Whether it's educational based or just fun, learning. I don't know if maybe, in the future you guys could look into maybe working with some Ellis Tech teachers during the summer to see if like once a month or every other week, they could just do some kind of crafts or something or something fun for them. Just something to look into. So, thank you.
I think it's, should be noted, that's probably one of the top responses we get about having more for kids to do. Frank and I were actually at the high school with a bunch of the kids, and that was one of the questions we asked them to fill out. Because, the question is like what? And that's, to me, always the part of the answer that's missing is, what are the ideas and what thoughts you have? I know you presented one in terms of working with the crafts, et cetera. So I'm just pointing that out, that when we were talking to the kids, we kind of asked them that question because that's what all the parents are asking and making the statement. And was, what is it would you want to do? And it was kind of interesting because the answers were relatively shrug of the shoulders a little bit. We talked about e-gaming a little bit. some kind of center for something along those lines, but it was just interesting that even talking with the kids, we want to do something, but nobody clearly wants to know, really knows what that is.
Wow.
So open to suggestions is good.
I know that besides Ellis Tech, maybe there could even be something where we do like work with the veterans and like maybe, it's kind of like 2 for 1 where, retired veterans can get some company and, get out and do stuff with the kids and teach them, basic things or even maybe hikes or walks, mild and appropriate for ages, of course. Just that sort of thing to get them up and moving and just kind of get everybody involved with each other. So I think it'd be nice.
Good, thank you.
Thank you. Thank you for coming. Appreciate it. Okay, folk, approval of the minutes. The minutes were not done yet. They will be done for the next meeting, and we'll approve the last one as well as these, okay? Ashley has not been in the office for a few days, and she is just involved with something, I'm not sure, okay? Not to worry. So that brings us to new business. Here we go. We have 2 persons tonight. I see up front, thank you very much for coming, a representative from the United Services, Social and Health. So if you would be kindly introduce yourself and then tell us a little what you do, and I know there will be questions for you from the group.
Okay. Good
You know how to
evening.
turn it on, right?
I
Yeah.
did. Okay. Good evening. I'm Diane Manning. I'm President and CEO of United Services. For those of you that don't know us, we're just down Route 12 in Dayville. But we are we have a number of different roles, but we are the local mental health authority, so we are charged by the state with making sure that there are mental health and substance abuse services for the residents of the 21 towns of the Northeast, not just Killingly. It's one of our towns. We are also a federally certified community behavioral health clinic, which means that our services are available to anyone who wants to come in for mental health or substance abuse treatment, but also assistance with medication-assisted treatment, child and adolescent services, case management, assistance with finding and maintaining housing, employment services for those who need it, and then we do some social rehab for ages 18 and older. We also operate the domestic violence services in this area, including a shelter, but also we work in the courts with victims, and we also do jail diversion and work with the state police and the local police departments throughout the 21 towns to try to work with people so that they don't have multiple annoyance contacts, for lack of a better term. We're not talking about individuals who have felony convictions or felony charges, but the misdemeanors, the annoying things that bother the downtown merchants, that bother people in the neighborhoods, and really work with people to try to divert them from being arrested and having multiple contacts with the police, but also to try to get them to be more independent and able to live in the community. So our bottom line, our mission is to support people so that they can live successfully, independently in the community. We don't do a whole lot. We don't do any inpatient care. We don't do any residential care except for one group home that happens to be in Plainfield, but that is a rehab home. So you go into it with a treatment plan, you go through the treatment plan, go back out into your own setting, whether it's a rental apartment or wherever it might be. But it's all about getting people back on their feet and in the community. Mhm.
Thank you.
And I did bring some materials. I have our annual report, so
That will be very nice. We'll
and
handle
then some
that.
materials about our various programs, so
That
that
will be
you're more than
helpful.
welcome to take those.
Do you have any views from your group's point of view, what you think should be in a vision statement from the town of Killingly as to where maybe you think things should be going in the next 2, 3, 5 years? that would be helpful to us in getting a strategic plan going?
The populations that we're seeing that are struggling the most are young people, and depending on what's going on, we're seeing kids as young as 8 or 10 having interactions with the police, which would have been unheard of 10 years ago. But finding that they are not involved in what are called pro-social activities, they're finding ways to keep busy, but it's not necessarily the best ways. So looking at some opportunities, we are the Youth Service Bureau designated for the town of Killingly. We do some work in the school systems. It is woefully inadequately funded, and in fact, the town of Killingly does not fund the Youth Service Bureau. So even though we are required to provide the service, you don't pay for it. So that makes it a little hard for us to be too creative. So that's one age group, and then the aging out groups. So the 16 to 25-year-olds that have not necessarily learned good work skills, that have not figured out how to work. Again, it's that independence in the community. How do I take care of myself in the community? And this is not unique to Killingly. It's absolutely not. But it is something that we're seeing even in the workforce that's coming out. If you will talk to business owners, they will tell you the workforce isn't prepared to work. And that's one of the things we're seeing as well with the individuals that we're working with. Multiple failures, may have dropped out of school, dropped out of work, can't hold a job. And so looking at what would make sense. There's some interesting projects that are out there that really look at doing work preparedness training. So not just the GED, but how do you get prepared to be an employee? It's not something we do for a lot of people, but there are organizations that do it. There are programs that really are designed to teach people about showing up to work on time, showing up to work every day, showing up to work in the right clothing, all that kind of thing that you'd think would be taught, but it's not, or learned, and it's not. It needs to be taught. So that's one of the areas. The other area we are seeing a huge increase in need is with seniors.
Is what?
They are seniors,
Okay.
the older, and I'm going to say seniors 55 and older because that is an age group that has starting to, oh, sure. There you go. That's an age group that's starting to lose their families and lose in the course that they've moved out, they've moved on. They are socially isolated, they're financially isolated in a lot of cases. And that is a group that we are seeing that is silently suffering. So they're short on food a lot of times, they're certainly short on socialization. Many of them find it difficult to get around, so public transportation is absolutely needed to help them stay connected to the community and not age prematurely. And many of them could work if they could get to work, even if it's part-time, but that would be both socialization and a financial help for them, but they've got to get there.
So, in order to accomplish that part of it, you think we need better transportation in the town, public transportation?
I think that public transportation is extremely important for both ends of that population, the young people and the older people, because without it, they're isolated and they cannot be part of their community, cannot be easily part of their community. Think about if you live in downtown Danielson, where we're sitting right here, how hard is it to get to a grocery store?
Oh, yeah, I agree.
So,
What percentage of the senior group, I'm a senior, that's why I'm asking, what percentage of the senior group do you think actually uses the senior center that's across the river in Brooklyn?
I don't think it's very highly used for
Okay.
most people. I'm not sure it's easily accessible.
Yeah, okay.
And again, there are different populations of seniors. There are people who are more active and would want to do something that has a tendency to be a little passive activities there. And it might be very appropriate for older seniors, but when you're talking about the 55 to 65 age group, I'm not sure it's the best place for that.
Okay, thank you.
Hi. If you could choose statewide, townwide, a certain topic that you guys are struggling with at United Services, would you say it's mainly the transportation topic, or would it be anything else, regardless of town or state who could help?
The transportation underlies everything else. Getting access to food, getting access to work, getting access to treatment if that's what you need, even medical care. Transportation is a barrier for everything that you need to do to survive well in the community. And it is a barrier here in Killingly.
So it's basically the root of the cause, to an extent. Okay.
But I don't know that it's the cause, but it certainly is a cause for not getting better.
Thank
It
you.
sounds to me like it would offer the greatest return on investment.
I think it would be a huge return on investment, and really make access to all of the other things that people need much easier.
I'd like to preface this by saying that I can appreciate this because I actually own a private practice. I'm a therapist. So I'd like you, I have a couple questions for you. I'd like you to give the town of Killingly a grade in terms, if you had to give them a grade in terms of the support that you receive from them, financially or otherwise. It's going to be otherwise, right? So I'd like you to give them a grade, and then I'd also like you to tell me a little bit about like your referral process. Like, is there a percentage of folks that you have to refer out to outside providers? Do you have providers that you work with, and what does that typically look like?
We are an enhanced care clinic. We're designated as an enhanced care clinic under Connecticut Medicaid. That means that we are required, if someone comes to us or requests services, we must serve them, we must have a first appointment with them within 2 weeks. That means everyone gets seen within 2 weeks, and 2 additional weeks to see a prescriber, psychiatrist or a psychiatric APRN. I have 9 prescribers on staff between here and our Mansfield office, so we have access for that. We do not, as I said, we don't do inpatient, we don't do partial hospitalization, which is a a 5-hour day program for those who are not familiar with that. We don't do those intensive levels of care, and we regularly refer out to that. There are some specialties that sometimes it's better for us to refer to someone else in the community. We will assess that. There are some very severe eating disorders, for instance. There are individuals on the autism spectrum that we may struggle to deal with because they're not verbal, and we do verbal therapy. So we will make referrals to other providers in the community for that. And sometimes it's just someone would prefer to be someplace besides a clinic. We do have accessibility, and we are also available 24/7, so our crisis services are mobile 24/7. So if somebody's in trouble, and that's a lot of times where we'll get a call, particularly for someone who's just starting on their journey with mental health issues, that we're going to get a call through our crisis services and see them. We see crisis services, we must be in contact with them face-to-face within 2 hours. 2 days if they're being discharged from the hospital, 2 weeks for a normal referral. And we have to report that, and we get graded on it. So we meet those criteria. So that is less of an issue. It is more of an issue when we're looking for housing for somebody. It's very difficult to find housing for somebody who doesn't have a whole lot of money. And so that can take a lot longer. We could be working with someone for a long time just trying to get them on waiting lists and finding ways of paying. It depends on the service.
Let me just ask you a question. There are a number of other agencies in town, such as Access and others. Do you folks work together, coordinating to maximize the input you can do?
Absolutely. If there's one thing I can say about Northeastern Connecticut, we are pretty efficient about not duplicating what we do. So we work together all the time. Our staff on the streets are working together. My staff goes into the Access shelter. They don't have mental health staff. I do. So they call us to take care of their mental health problems. I don't run homeless shelters. If I need housing for somebody, I'm going to be calling Access. It doesn't make sense for us to duplicate it. The same thing with Generations. They have medical care. They have psychiatric. They have psychiatric nurses. They have some therapists. but we have the capacity to go deeper into what's going on. So if they have someone that needs more than they can do for them, they will refer them to us. We're in Day Kimball Hospital every day, working with their emergency room, working with their psychiatric inpatient units. We're with Bacchus Hospital, working at their emergency room in Plainfield if that's what they need. We all kind of know what we do and work together all the time because frankly, there's not enough resources out here for us to duplicate. So we've kind of each got our niche and we figure it out. And I was on the phone with someone from Generations earlier today and then someone from Alliance Health because they do some education supports and we needed to make a referral. And so they do it. We don't. We make a phone call. EastCon actually is running their ESL classes, their English as a second language, and their GED classes for Plainfield in our building in Plainfield because it didn't make sense for them to have another spot. It works beautifully. We have space, and my clients can go there. It's great. So we do those things all the time.
Day Kimball Hospital too, you're somewhat involved with that?
With Day Kimball, we're working with the psychiatric crises in their emergency room, and then if someone is admitted to their psychiatric inpatient or a medical floor but has a psychiatric follow-up that's needed, we have a hospital liaison that actually is the person that contacts them. They make the referral out to us. We have contact with them within 24 hours to make sure that all the follow-ups are done. They have their medications, they have their follow-up appointments, everything's in place. So we have relationships to share information to make those referrals back and forth.
Okay, all right,
Mhm.
thank you.
Would you say your communication with other businesses is pretty good? We kind of keep getting that a lot, is that the communication between different departments and different businesses is lacking. But it seems like from what you're saying is that you guys communicate very well.
We communicate within the healthcare and social services. We also provide employee assistance programs. I think I actually put that in there. We have contracts with some of the local employers. So if you go up Cold Plastics, Spiral, they contract with us to provide services for their employees. So we have a lot of contact with them. Not with every employer that's out there. And every other department. We sometimes frankly struggle with the school system here. Sometimes they're welcoming, sometimes they're not, depends. So sometimes we struggle with trying to work with a child who's in the school system and trying to get information or share information that we know that they should probably know. So it depends. A lot of it is personal relationships.
Okay, thank you.
Mm-hmm.
All right. I'm looking at your numbers, and the one that obviously stands out to me are the units of service that you did in 24 and 25. Out of those units of service, do you feel that you were able to handle 80% of the requests, 90% of the requests? And are you seeing those service unit quantities getting even higher in 26, 27?
Yes.
And-
I actually have the Town of Killingly's data, which we sent.
Which was going to be my next question.
Yeah, we sent that along to, actually, I copied it without the numbers on it. That's great. The Town of Killingly's increases have particularly come in two areas, in crisis services and in medication-assisted treatment. And medication-assisted treatment for us is for opioids, alcohol, and tobacco. And so those are the things where we will do medication-assisted treatment. We're seeing more alcohol than we used to. I mean, it used to be opioid and the alcohol had kind of tailed off. It's back up again. We certainly are seeing vaping, but there's no medication for that, so you're not seeing it on that side. But those are where the numbers are up is the crisis services, that people who are waiting till they're really hurting before they're calling for services. Our outpatient numbers we're up 24% year over year in outpatients served. And some of that has to do with frankly, one of the local providers' perception programs went out of business last year, and their clients had to be picked up. They had 30-day notice, and they had to be absorbed. And we did. So we cannot maintain a waiting list. We're not allowed to have a waiting list. So everyone gets in the door. And then we see them as frequently as we can. In a lot of cases, we will use groups if we need to, which is actually, for some diagnoses, is the best treatment anyway. So it depends on what it is. But-
Our job is to
Mhm.
create a program of what the community thinks, what the direction the town should go in, say, the next 5 to 10 years. Obviously, public transportation is
Right,
an
exactly.
absolute. You mentioned something about, and I wasn't writing fast enough,
Right.
town funding for some current existing programs.
The state has every town designate something called a youth service bureau. In the Northeast, because we're efficient, you have a youth service bureau that covers 6 towns. It covers Killingly, Plainfield, Brooklyn, Sterling, Canterbury, and Eastford share the youth service bureau, and they've designated us to be that organization. The other towns actually give us some money to do that. Killingly doesn't.
And-
So we do that with as much as we can donations, but it means that we can't do as much as we could do. And
What
it's not a lot of
is-
money. The request for that, for this year, let's see.
Exactly what does the youth services, what are you supposed to do
Okay,
in
the
that?
Youth Service Bureau is supposed to identify needs for youth in the town, and that is considered up to 18 years old. So look at needs, put together programming for individuals who are struggling, for kids, work with the school systems around after-school programs. So we do have an after-school program with the, I think of as junior high, I think you guys call it intermediate school, Killingly
Yeah.
Intermediate. So we have 50 kids that are at Killingly Intermediate that are in an after-school program, except that Killingly doesn't have a way to transport them, so we do it during their activity period, not after school. So, but it could be an after-school program if they had transportation. And we work with those kids, and they're the ones that are, they're not the problem kids, they're the ones that get lost in the shuffle. So the ones that don't exactly, they're not star athletes, they're not special ed, they're just normal kids. But we try to give them a place in this community. So they become the volunteers. They're the ones that are working at the various, if the school has an assembly, they're the ones handing out programs. They're the ones helping people find their seats. We're giving them a reason to feel like they're important, because they don't look important. They're in the middle. They just don't. Kids love it. It works really, really well, and it can take somebody from being lost into being a star.
And it's called the Youth
That's-
Activities Bureau, or Youth
Youth Service
Services Bureau?
Youth Service Bureau, yeah.
Okay, thank you.
Mhm.
If I could, just to follow up on that point, you were looking for a number. Was it the amount of funding that you were going to request of the town?
We
I'd
did,
be
we did
interested
do
in
the
what that
request, I was just
figure
trying to
is.
read quickly down through, because it's in the letter. It's probably buried here. The Killingly's portion of it, so we get an amount from the state we're supposed to match.
Hmm.
If Killingly doesn't match it, we have to come up with it out of fundraising. So the match was $20,523. And you have, under the age of 18, 1,749 residents in 2025 that fit that calculation.
Okay.
Thank you.
One of the comments we have heard when you were talking about the youth is that sometimes after high school, if they don't go to college, what is there for them to maybe create some training, get them employable, or something like that? Do you work at all with that?
We work with the Workforce Investment Board around some of the youth development work. A lot of what they're doing is training students to be CNAs, to be EMTs. Again, it's in healthcare because that's really what we have an expertise in. But part of what needs to happen is also just basic work skills. How do you go to an interview? How do you interview? How do you show up to work the first day at work? How do you show up the second, third, and fourth day at work? But some of those basic things that you don't learn in school, and maybe you absorb in the community, maybe you don't. But programs like that to really look at some of these young people. I mean, if you look at the employers around here, they're crying for employees. And they're out there, we just have to match them up.
You know, one of the things we said, for a small thing, how many people know how to put a resume together, for example?
Exactly.
How to show the employers what their skills are or what they can be trained for. We have heard that quite a bit, I think, right?
Right. Well-
So it's a factor.
And even where do you look for jobs? I mean, it used to be you looked in the help wanted ads. There's no such thing anymore. There's Indeed and there's online job boards. But if nobody teaches you how to do that and to recognize how can you find the jobs where you have the skills, or many of the employers around here will teach you. If you're willing to learn, they will put you into apprenticeship programs. They will teach you how to do these jobs. But you've got to connect and you've got to commit to the job.
Okay. Yeah, thank you. Any other questions from the group? Sarah?
Do you
I
see?
have some if nobody else does, but I can wait
Oh.
if somebody else does.
Oh,
Sorry, Julie.
Did you forget I was here?
voice.
She's up there.
Got her to go.
I'm sorry, it might be weird because you can't see me, sorry.
It's okay.
Do I go or is
Yes.
it someone else's turn?
You go.
I go?
Yes.
Okay. Hi Diane, thank you for coming. I just learned a lot and forgive me if my notes are kind of choppy because I was trying to keep up. So the first thing that I put was the homeless situation. So you help with that? Is that something that's under your scope?
We work with people who are homeless. We do not do the housing for homeless, except if it's an individual, again, it's a little bit specialized, that's coming into domestic violence. There's a rapid rehousing for domestic violence. Access does that for homeless that are not domestic violence. But again, we refer back and forth with that.
Okay. The reason I'm asking is with I'm a member of Westfield Church, and when I volunteer there each week, like for example today, throughout the entire morning from 9:30 to noon, we constantly have homeless coming in and getting supplies, whether it's like hygiene supplies or even food and stuff like that. They need backpacks right now. Is that something that you help with?
If we have them, we do hand out, again, we collect from churches and other places that donate to us. For individuals that we work with, we have about 300 of the 5,000 clients that we work with that are homeless right now.
Oh, wow.
And so we do collect, again, hygiene materials, towels, sleeping bags if necessary. As much as we can, we work with Westfield. We've been part of that planning along with Access and Generations. It's just very difficult. Even if you have benefits, they do not, like SNAP benefits, you cannot use them for hygiene. And think about it. If you can't buy toilet paper, you can't buy soap, you can't buy shampoo, you can't buy deodorant.
Yep.
Hard to go to work.
Yep. So, do you have backpacks right now that we could give to them? Because that's something that they've been asking for like all morning today.
We have some. I'm expecting another set from one of the churches, but we don't have them right now. We probably have enough for maybe 30 people.
Okay. 30. Okay. So how do we connect them with you guys?
If they just call and ask for our crisis team, they have them. They have the materials.
And then if they don't have a phone, we could call with them.
They can walk in.
Oh, they can just come right in. Got it.
Yeah, they
Okay.
can walk in.
Okay. And then the other thing is, I don't know how to really bring this up, but another thing is, we've had some issues with like giving gift cards and like them being sold for drugs. Is there a program, because I know you said you work with drug abuse, is there any type of way that we can control that you know about, or something like a program that, I don't know.
We discourage gift cards.
Yeah.
Anything that can
Discourage.
be easily turned into cash. It is better to hand someone a bottle of shampoo than the money to buy it.
Got it. Okay.
So-
And then, so that's good to know, which, I'm sure that's probably why we've cut back so much with that.
Right.
And then I put that you're partnering with more of the healthcare system, but the school's not always, it sounds like easily maybe accessible. I'm not really sure, like how you are wording that with, because I know that when the school needs information like from David's therapist, we all like have to make sure we sign like release forms. Is that what the issue is, or is it something else?
There's release forms, but there are times that we can offer to provide programs in the school to help out, to do some programming with them, and they're not always welcoming. And,
Not, okay.
so, one-on-one with clients, we will get the release, and the school will communicate with us. But it's really around when we start to see a pattern or something happens. If there's a death or something happens to a faculty member or a student, or there's something that happens, I have staff who are trained to handle that.
Yeah.
Not welcome.
Okay. Okay. Okay, got that.
And
I had a
that's
couple more
fine. I mean, if
questions.
they can, if there's ways of handling it, there's ways of handling it. But we are there. We are available to the community, and, we like people to know that.
And I was wondering about the Youth Service Bureau, like what, because my son's at KIS, but I'm not familiar with, like, how does he get involved in that?
At KIS, the program is called TOP, T-O-P, and that it's a referral from the school staff into that program. But if you ask, they're going to be coming up with 50 kids for next year, so there may be some openings.
I think that would be great for David, but I didn't even know that existed. But he did do the play. They had a play this year, and he did the play. So thank you for explaining that. And then, as far as like our free meals, would be our guests, are like the people that come to you informed of those? So if they are in need of that, they know where to go, or?
When someone comes in and we do their initial assessment, we kind of go through a whole list of needs that they may have, and we have some care navigators that can help them access the other services that either we have, or if we don't have, other community agencies do, so that part of what our job is to connect people to what they need.
That's what they need. Okay. Awesome. I got that. And, so we do have a meal this Friday from 5 to 6 at Westfield, and it's going to be grinders and pizza. So just if you need to share that with them. Yeah, okay. And what is currently being used for transportation for like the senior population? Because I can't imagine it's just solely the public transit. Is there something that might be more accessible for, for like, I'm disabled, so like somebody that might need a little bit extra help getting in and out, that kind of thing? Is that what one of the main issues is?
It's less that, it's just the point-to-point access for somebody who doesn't live along the bus routes, because the bus
Yeah.
route is
Oh.
a lifeline for people. But if you don't live there and you can't get as far as the bus line, that becomes more of an issue. Medical transportation out here, for those who have Medicaid, which a lot of seniors do, behind their Medicare, they can take medical transportation, but it is vastly unreliable. So if you
Yeah,
make an
I-
appointment with a doctor and you show up 20 minutes late, you might not get the appointment might not be held because other
Yeah.
people are waiting as well. So that becomes an issue for people.
Yeah, I actually can't always, like tonight, I mean, this isn't the reason why, but I can't always drive when I need to because I get the daily migraines in the sun. And so, but I don't know, I wouldn't take a bus. That's the other thing. So I don't know if there's something that we would be looking for people that would be more like a taxi service or something around here that would be like, affordable or have like a path to be able to, you know, have a fee to take it or something, or how we would even go about doing something like that. Or if I didn't know if something like that already existed and I just didn't know about it.
Well, it does.
You-
It's
you
called
go
Uber,
and say
but
something.
it doesn't exist very much
Just
here.
Uber.
Jay Lee, do you have a couple
Yeah.
more questions? Because we really need to move on. We have the second interviewer here, and he's just here waiting. If you have a
That
couple.
was my last question. That
Okay.
was my last question.
All right, thank
But
you.
thanks, Brad. Thank you, Brad.
Thank you. And thank you very much for what you provided.
Thank
Yeah,
you.
thank you for
Thank you.
Yes, appreciate you coming and
And
answering all the
the materials are
questions.
there if you want to leave them downstairs so people can grab them, that would be great, or I can take them down with me.
Okay.
Oh, yes, yes. Mm-hmm.
Coming up, Jim.
We're lucky to have Diane at the helm of
you-
United Services for many years.
You switched on?
Yes, I am.
Okay, thank you,
I'm
Jim.
so loud you wouldn't know the difference, Frank.
All right, Jim, tell us who you are so that they know who you are.
So I am Jim Rivers. I'm not going to go through my entire biography, which some of you probably know already. I did grow up in Killingly, though. I was born and raised here, and I'm currently the executive director of the Northeastern Council of Governments. I've been in that role for about a year and a half. I don't know exactly what you want me to talk about tonight. I can speak for hours, Frank, without a question. But you guys have asked some really good questions tonight, by the way. I've learned some things myself, and I've listened to Diane many times over the years, and but I picked up a few new things tonight.
What we're looking for is what you, in your capacity what you think the town needs to improve, or things that you think the town is doing very well, and they need to stay with those things. We're just trying to provide a vision for where the town should be going in the next 10 years.
So I have a unique perspective, perhaps, because not only my role at the Council of Governments, by the way, I've been at the Council of Governments many more years than the year and a half I've been the director. I was sat on the council as the first selectman in Pomfret 21 years ago, and I was the chairman 2011 maybe. So I have a perspective that goes historically as well with the organization. But I also, again, as I mentioned, I was born and raised in Killingly, and there was the one comment from the public was interesting because I wanted to talk about that a little bit. The park. So I'm gonna go off tape here a little bit, but that park is probably one of the best assets this community has had my whole lifetime, and the history that I have there personally. I was playing in that park before it was a park. So in the early 70s, that park was really developed. The Little League field was there, but nothing else was there. In fact, it was an area where you would dump your trash on the edge where the playground is, not hazardous waste or anything like that. But it was just like a lot of these 100 little dumps in Killingly all over the place where you dump your old stuff, you know. And I can remember playing in the stuff. That was my playground. So my family owned the house where Jewett City Savings Bank is now. And so, you know, we go back about 5 generations in Dayville, one side of my family. So that park is near and dear to my heart. And in full circle, I'm looking at that park every day from my office window at the Council of Governments. So I really appreciate the park. And I've been there all my life. I played on everything over there, every field, every court, and brought my kids over there as they were able to do so. So the park, I think, comes to mind as I was hearing the discussions here. It's sort of the center of the town, you know. I know there's a downtown and there's industry, but that park, and to go down there recently with my wife, having ice cream, it's buzzing down there. I mean, there's a lot of people in that park. In this day and age when these things in our pockets dominate our lives, that park is critical. And how could you, if you got something good going, you do more of it, right? If you got something bad going, you do less of it. And I think the park, I know that's a little off track from the Council of Governments, but my time in Killingly, it's a multi, you know, from birth to grave, that park is valuable. And it really serves the community well. A free place to go in this day and age. And there's just something there for everybody. So the park is, again, just gut reaction, without getting too technical about jobs and all the things I do day to day, transportation and other services. It comes down to, boy, the park is awful nice. So do more of that.
One of the things, Jim, is that we're looking into how to, I'm going to use the term, market Killingly, so that it's a place that people want to come visit, live here, etc. Now, you must have the same kind of thinking of marketing Northeast Connecticut.
Absolutely.
So what are your views of marketing us?
So another hat I had, I was the town manager in Wyndham, in Willimantic for 7.5 years, and we had a problem. We had a reputational problem out there when I arrived, and we really focused on how do we change the reputation out there. And it was a multi-pronged attack. It was infrastructure. I mean, we were in a different place than Killingly is or was. So that was a whole different mission. But you know, we spent a lot of time there. It was infrastructure. We needed infrastructure to really draw more business, to, you know, make sure we had crime under control. Those things. Those are different issues out there than Killingly was in a different spot. So back to marketing, I think what we did for marketing out there, we went statewide. We're trying to draw in people to bring money and relocate to Wyndham. We wanted money. You need money to do things. And I think every community is different. They have a different objective. It's what before you get into marketing, what's the end game? So if it's drawing, and I just mentioned briefly, when I lived in Pomfret for a number of years with my kids, we came to Killingly to use that park. So we came to Killingly's downtown. Went to Killingly, Dayville to shop. That's a lot of these smaller towns need to come to Killingly, Putnam, Plainfield, because that's where the service areas are, the shopping. So when you're marketing Killingly, are you going to keep it to the area around here? Like Putnam, they market, you know, they're looking to get people from all over. But a great number of the people that go to all the events in Putnam are from the surrounding towns of Putnam. I go there myself, and you see all your friends and your family there. So again, marketing, we ran ads in Wyndham on TV for years. We had a budget, a $30,000 budget to run TV ads. So you can do that, but what are you trying to accomplish? If you don't need people to relocate from the other side of the state to Killingly, if that's not what you're trying to accomplish, then you don't want to market on TV to get them to come to Killingly. So are you marketing to your own people to use the things you already have? Are you marketing your neighbors? So let's delve into, so I have 16 towns, for some of you that don't know how NECOG works. And those 16 towns range from Union, the smallest town in the state of Connecticut, to Killingly, which is the largest town in our group, and you're around 18,000, I think now. So, and all the towns in between, from Union to Voluntown to Ashford, and everything in between is the Council of Governments, Northeast Council of Governments. There are 9 councils of governments now in the state of Connecticut. There used to be 15. They consolidated around 2011, 2013, somewhere in there. And now there's just 9. So we have 16 towns, and we have grown quite a bit. The number of things that we do for all the towns has really expanded in recent years especially. So go back 20 years ago, we did not provide a whole lot of regional services. We had transit districts, so it's interesting dovetailing off of a lot of your questions were around transportation. That's what we do. We are the transit district. And so that was there. That really was the basis of Northeast Council of Governments. It was a planning agency, and that was big picture stuff behind the curtain stuff that most of the public didn't know what was going on. They've been a planning agency, I think, from the 60s. And then the regional transportation, and you remember Dial a Ride, we have something very similar to that. Now we have the bus routes. So those are the founding blocks of Northeast Council of Governments. But along the way, I'd say about 20 years ago, John Filchak was our director for 29 years. We started to get into other things, and we were doing other things to create economies of scale. We started with an engineering program, and we had a number of other things started to add on. We had regional revaluation, which Killingly actually participates in right now. It's sort of we don't perform the revaluation. We bid that out to a firm that would perform that, and we have about 12 towns now to get scale and to save money, and also helps with the scheduling and having the resources. So there's a number of benefits for that type of program. Killingly doesn't really participate in most of our programs, the direct service type programs, because you're large enough where you have your own resources. You have your own engineering department, you have your own planning department, and you should, the town your size. You're not, Pomfrey, not Union, you're not Eastford. Those towns can't afford to have their own full-time planner or a full-time engineer, so it makes sense for them to get together with other towns to do things. But there are things that Killingly does share with all the other communities. The paramedic program is shared amongst, I think, 8 communities. I'm going to get my numbers wrong here. And I mentioned the revaluation, but of course animal control. We have 20 towns, even towns outside of our region. And again, to create that economy of scale is how these things got off the ground. Now, I will say that in recent years, it's not saving money anymore. It's just getting the job done at all, because there's such a shortage of skilled people in the municipal and the government arena. And a lot of these things that we do in the municipality requires a special education and special training, special certifications by the state of Connecticut. And there's not enough people to do these things. Everything, if you can think of it, right now there's a shortage everywhere. Planning and zoning, zoning enforcement officers, wetland enforcement officers, assessors, tax collectors, finance people, town administrators, town managers. There's shortages everywhere. So it's not about money anymore. You're going to pay. It's not, to find the person is the key. So what we have been able to do is provide some help to, especially a lot of smaller communities where they can't compete with a Killingly to find somebody to do, say, planning and say wetlands or zoning. You might want to hire us to do some of that because you can't even find the person. So it's not just money, it's finding the person. So we have 4 divisions, I call them, within the Council of Governments. One is the Transit District. 2 would be the Animal Control Division, because it's pretty large, about 12 employees there now. There would be the Transportation Planning. So one thing we do for Killingly that you don't do, but it's kind of general services out of councils of governments across the state, is this all dealing directly with DOT on all the grants and all the work they do on the roads. They check with us before they do a lot of things, and we're sort of that conduit to all the communities. So it's a specific type of planning that kind of goes through the councils of governments before money may end up in your hands, or you get a sidewalk done or a road done. It might be a state road. And a lot of that flows through us. So that's transportation planning and other planning. So planning, we have planners that actually serve towns directly. They hire us to be their planner. You have other tasks that the state has levied upon us recently, such as the housing planning, the regional housing plan. So that has now we've hired people up to deal with that multi-year task to try to come up with a better way, a more improved way to have additional housing in Connecticut, affordable housing, or any type of housing for that matter. It's not just affordable, it's any type of housing that there's shortages of. So that's the planning division. I'll call that number 3. Number 4 now is probably the fastest growing area of our organization, which is the services, direct services. Most recently, we added a human resource person, and 50% of their time works in the town of Plainfield. And again, because of shortages of workers and the rules are changing, there's a lot of things you got to do now in human resources. Plainfield recognized the need for having a resource, but they didn't want to hire a full-time human resource person because that person can be quite expensive. 7 of us at the Council of Governments have master's degrees. Several of the ones that don't have master's degrees are my most experienced people that I have. So you know one of those people, which is Mary Colario. Obviously, she was here as a town manager. She is one of my town administrators and helps 3 other towns and is also the director of transportation at the Council of Governments. But Mary is also the president of the Council of Small Towns, which is a organization that represents all the small towns. I don't want to say it goes up against the state, but it's another way to get things the small towns need. Killingly would be considered a small town. And it's sort of a lobbying group for specific things that small towns might want. And they go to the state representatives, or they go to the executive branch. So this organization, most of the towns in Connecticut, small towns in Connecticut, belong to it. And Mary happens to be the president. So we have a lot going on at the Council of Governments. We have GIS, Geographical Information System, I think we provide direct services for 10 towns now. We host that service for most of those towns. We have grant writing now. Now, Killingly has grant writing capability, but as an example, there's so many grants, and some of them are very specific. There was a brownfield grant recently that went through my office for Killingly. It was a $150,000 assessment grant, brownfield assessment grant for the old Broad Street School. So even though you may have it, there's just so much out there that you can go after. You don't have all the resources to do it, no matter how, even some of the biggest towns. There's so much to go after. So those are the 4 basic areas or main areas of the Council of Governments.
I understand that you're working with many of the smaller towns who don't have the capabilities. But if I may be specific, 1, are you working with our economic development person? And what are you doing working for Killingly at the moment to help us?
So we do work with Jill. We've had a number of events up at Putnam. I don't know if any of you were there. The last event was a regional economic development forum, and there were probably 40 or 50 people there, all economic development directors. Killingly was represented. I think Patty was also there. She is the tourism former council member here. She is the former. She is on the tourism board.
Are there any specific projects that you're working with Killingly on?
You mean like bringing in a specific business or
anything?
We wouldn't go and seek a specific. We're looking more broadly at bringing people together or developing a regional plan. We wouldn't go after a specific project and handhold them or hand them off. We wouldn't be out there. They don't come through our door. We don't get solicitations by businesses, or I don't know if that's your question, Frank.
I know, because I've read it, that you have a strategic plan.
Yes.
Except
yep.
It's very
comprehensive. Yep.
Very out of date. I think the last time I spoke to you, you said you were in the process of rewriting, and I don't see a lot of strategic planning in that. Just statements of things that you're going to do. Do you have a strategic plan now for the next 4 to 5 years for your area?
So in the economic development area, there is the CEDS, the Comprehensive Economic Development Strategy, which is online, and it was just rewritten, I think, and it's a dashboard with a gazillion things on it that was just rewritten. So I don't know if you've seen that one, or
I looked about a couple of months ago.
No, there's a lot of information there,
It's very general, though.
well, we're not gonna get into like, okay, Killingly needs to put a factory here and call up, so-and-so to get there. It is gonna be more general. We're working from a regional standpoint, not necessarily a specific town, specific task. Now, you could drill down into that, I suppose, if we continue on with the work, yeah. But we don't wanna start telling towns what, get too specific on what, a specific project, is that? I'm still not sure what you mean.
No, it's, you do get funding from the town, right? From Killingly.
Correct, yeah.
So, partly I'm just sort of wondering, what does Killingly get back for that?
Well, you just got a $150,000 grant you probably wouldn't have got because it wasn't. We also, again, what you get is the framework to do all these other things. Like, there's no administrative fee for all the other programs. The programs stand on their own, or we try to have them stand on their own. So
Okay.
the framework for transit, for animal control, and I'm just rattling off the things that Killingly subscribes to, the revaluation, there's no charge to manage all that. You're just paying whatever the fee is for that service. The other thing I will mention is we are your lobbyists too. So again, I spent the last few months in Hartford lobbying for various projects. One of them was a new animal control facility, which Killingly is a major participant in that program. So again, the framework is there at, you pay an assessment. I think that might be what you're talking about, and that's about $1.13 per capita for all the towns. That creates the framework, but we also leverage that and get a number of other grants from the state, because obviously that's not a lot of money to go very far. So that creates that framework to do all the other programs that we do. Obviously, bang for the buck, the smaller towns are getting more bang for their buck. As an example, some of them belong to the engineering program. It's subsidized a little bit from other state grants. So they get an engineer at their call for a very low price. So if you don't participate in some of the other programs, you're not gonna maximize that base assessment that you're getting charged. But in Killingly's case, again, like I just said, we picked up that grant, and that's one thing. But the SEDS that you would mention, the economic development plan, that's one plan that we work on. But working on other types of plans, they come and they go. So I'll give you one that we're working on now, the hazardous mitigation plan. It's required to have a hazardous mitigation plan to get access to other grants down the road. So Killingly would, obviously being part of the Council of Governments, would be a participant in that hazard mitigation plan. Killingly, again, doesn't participate directly with specific services. We don't provide a lot of direct services to Killingly, other than the ones I mentioned. But all the general programs, Killingly is getting the benefit of these regional, we're still that regional planning agency too. So we do a lot of other stuff now, but we are still the place. I'll give you an example. If there are a number of state DOT grants that have to go through us. So if you're not a member of the Council of Governments, you're not getting them. And that could be millions of dollars. I'll give you an example. Putnam has been really cashing in on those DOT grants, sidewalks. You see a lot of projects going on up there. That all goes through us. So that's millions of dollars for Putnam in the last couple of years. Now, if you're not, we'll get to what you should maybe be doing more of.
Yeah.
I think Killingly, for various reasons, personalities, lack of need maybe, or perceived need, has not engaged the council as much as the other towns have. I think there's opportunity there. There's a lot of grants out there. And if you're not searching them out, if you're not sticking your, Barney in Putnam is going after, he never met a grant he didn't like. He's going after all of them. STEEP grants, small town economic assistance grants. You can apply for up to $1 million a year. Barney, or Putnam, we got $2 million of the 16 towns last year, which to me is terrible. That's a pretty well-funded program. They keep adding to it. The state keeps adding to that program. And I took full advantage of that when I was in Pomfret. I went after those grants every single year. And a lot of towns don't go after those grants. So we're trying to assist the towns and getting those applications in for a lot of these grants that are easy. I call them napkin grants. You write a little bit of information. You know, some grants you gotta write a giant report to get a grant. These are fairly easy to get, but somebody's got to go after them. So I think, again, Putnam got $1 million in steep grants last year of the $2 million in the whole district, because they're aggressive. So if we're getting to solutions or vision here, it seemed to me, if I was in leadership in Killingly, that I'd want to take advantage of the things that we can do for you. We're not going to jam it, and I want to get into this for a second. We're not going to make you do anything. If you don't want it, we're not making you do it. We are not part of the state of Connecticut. I repeat that. We are not the state of Connecticut pushing mandates on you. Now, we may have to address a mandate to help you, but we are not the ones, we are pushing back on the state at times, not telling you what to do on behalf of the state. So again, Killingly has to want to participate, and I have towns that don't participate a lot. Some of them participate more than others.
Can I ask a question? Transportation, that was one of your 4. And now you're talking about my friend Barney
Yeah.
and grants.
Yep.
Did he get the money for what they're doing for seniors? They're providing rides. All you have to do as a senior is sign up and you can get a ride to the doctors, to the grocery store, to wherever. Was that through a grant?
No, I don't think that came through us. If it
Okay.
did, it was before my time.
Okay.
I don't think it did, but there's different transportation grant programs.
Yeah.
Actually, it might have gone through us, because I believe if he got the grant that I'm thinking of, I'm not sure which grant he got.
I don't know.
There is a grant that would go through the Council of Governments that we have to kind of prioritize or sign off, because if we had 16 towns all asking for a bus the same year, somebody's got to make the call here, and okay, we're not going to give you 16 senior buses in 1 year. So I believe if he used the program that I think he did, but I'm not sure, if he just went outright and bought it, he might have went out and bought the bus. But if he got a grant, there are grants available to get a bus for the seniors, and it would kind of work through the Council of Governments. So that is a good point one way or the other.
And the bus routes that go around in Killingly, they don't go to Putnam?
Yes, we do.
You
Yes,
do?
we do.
Okay.
So I just want to elaborate. Many of you asked these very good questions. Transportation is a problem, and again, scale is a problem for us. So we have a lot of people in need out here, but we still don't fill the buses up. And we don't have a lot of runs. Now, it's the chicken and the egg. We don't have a lot of people on the bus because they don't stop or run a lot. We don't have a bus stopping by every 20 minutes here in Danielson. There's a run, and we have what we call deviated fixed route. What that means is we have a fixed route, and there's these schedules, different colored lines, buses that go to Plainfield or Putnam or Thompson and Brooklyn. And then we will go off route up to a mile with previous notice. So you could call us and say, I'm close to we're talking about handicap folks.
Yep.
And all of our buses have handicap lifts, including our vans. I'll get to that in a second. But you can, there's a lot of regular customers. The drivers just know where to go. But sometimes people need to call the office. Hey, can you come pick me up? Deviation where I'm a half a mile off off of Main Street. Come pick me up. So we have that. Our problem is they don't run very frequently. If you don't have to get to work, it'll work out for you. If you have all day to get to wherever you're going, the shopping or a store or the pharmacy or whatever, it'll work out for you. If you're trying to get to work, so where we're really lacking here versus, say, Willimantic or which is tied in with UConn now, or some of the other larger transit operations across the state, used as more than it is.
Where is that advertised? Because to be honest with you, I didn't know about that.
Back to marketing, and Frank made a good point. We have not done a very good job over the years of marketing because that takes money. Our budget for transit is dictated by the state of Connecticut to the penny.
Yeah.
It's funded by the feds and the state, and they won't let us change a route or spend a nickel without it having, a specific purpose. So I can't just take $10,000 a year and put it into marketing without it being in the budget, and they have to raise the budget up to get anything at all. So we need to do a better job with that. And there's things we can do without spending money. We have staff, we can send our staff out and do a better job putting up posters in the senior centers or whatever. There are a lot of things we've talked about, and I think we're going to start to do more. Our website does have, obviously.
Well, that's what I was gonna say.
Yeah, we have that, and most people do communicate through the internet. You know.
The town of Killingly's website should tell
Yeah, we should
us-
be linked up. Everybody should be linked up.
Yeah,
Yeah.
they should tell me that I can
So there's an
call you and
opportunity
get
again.
that.
If you're listing opportunities, how do we make sure everything's linked up with council of governments? Because there's a number of services, animal control, and it might be already. I don't know. I haven't been on the Killing. I don't spend
Yeah.
a whole lot of time on the Killingly's website,
Okay.
but it might already be linked up. I'm not sure.
All right, okay. Oh, I'm done.
Basically, what I've heard is that you folks are really, the point of your organization is to be a resource?
Yes, we are the 16 towns resource, whatever you want us to do. And if enough of you raise your hand for the same thing, we might hire a specific resource that's permanent. But we can help Killingly or any town with any problem. I've been using this, and I hate to use a military term, but we're like the special forces of municipalities. Whatever it is that you might need, we can help you. If it's a temporary thing, if it's you're filling in for somebody that might be missing. Let's say your planner, you have two very good planners here, by the way. If you didn't have a planner, let's say, and you were trying to find one, we could help fill in. I mean, we could help you.
I think you've done a very good job explaining that.
Yeah.
It's been very, very good. I don't mean to cut you off.
No,
I'm
go
cutting you
ahead.
off a little bit. One of the questions that was asked a little earlier was about a strategic plan. And the reason, kind of really what we're doing is a strategic plan in a way. And I was wondering with you and your organization and the resources that you can provide, what is your strategic plan over the next 5 years? What are the top 3 things that you feel that you need to address for you to feel like you're providing a proper resource to Killingly and the surrounding communities? I noticed you named the 4 things that you are doing now. What is it you're not doing now, or you feel like you need to be doing more of?
Okay, so that is a very good question. So we're in the process of addressing things that I think we need in the next 5 years. One of them is more grant support. So we just added a resource and a half to grant support. And like I said, even though you have a grant person here, or maybe more than one grant person, there's so many grants out there, and that's just money you're leaving on the table. I don't care how big your town is. So we just added a person and a half, and they are, and one of them actually was Tracy Hansen, who was the former first selectwoman of Voluntown for 4 terms. She is one of my grant folks, and also economic development. So those 2 things are closely related, grants and economic development, especially when you get into the brownfields and the development of underutilized properties. There's a strong connection. So back to kind of what Frank asked, we need to do more of that. So our grant economic development department, because we really didn't have anybody there until we have half of Jordan, which is he's also a town administrator, but that's his background. He's a grant economic development person, and then Tracy is very good. So that's the department that we're really expanding because, again, the tie between economic development and grants is very close. You can't really, as a municipality, trying to create that infrastructure, sometimes you got to give it a little helping hand, and that's where the state or the feds can come in. But you got to go ask for it. You got to match it up, and that's where we're doing back to strategic planning. So we've had a number of meetings. Again, it's really at the beginning. So I'll call that a 5-year plan in that area, is to get, first of all, the plan. You have to have a plan, but then you have to execute the plan. Plans are great. You can have all the strategic plans in the world. In the end, you got to have the resources, the will to execute that plan. So we're kind of doing both at the same time because we need to do some things here. It's just create a plan. We have to execute as well. So I think your mic's off.
What other goals are you trying to hit over the next 5 years?
So
in
we
terms
are.
of
I say
providing more
one of the
services?
biggest goals that would really help Killingly is a better animal control facility. So we are in the process of buying a piece of land. We're very close to closing on that piece of land in Pomfret, right over the border from Killingly on Route 101. That would be very good for Killingly, because obviously you're a pretty big town, and a lot of our calls go to Killingly because of the population. And that will also include a large animal facility, which right now, and you had a case a few years back where I think it was a number of horses, can be
Yeah.
quite expensive to board horses while we're working through things sometimes in the courts. So this is going to have some capacity for large animals as well. So I think that will really help Killingly. That is a multi-year, I would say, if I can get my hands on some of the money this year from the state, I'm looking for some bonding, that's a 3 or 4 year project to complete that. So there's in the 5-year window of things we need to do. We are also freshening up our transit fleet. We're getting 6 new buses next year. It's a multi-year process to get anything. And we will have those onboarded, those buses. And with that, in parallel, we are trying to get over the next few years, a better communication with our transit customers where they can book a ride online and not have to make a phone call, so more automated. We'll know where the buses are all the time. If you go to some other transit districts, there's TV screens in the facility. They can show you where the bus is, because there's a
Those are good. Appreciate it. Thank you.
So anyway, those are some things, but there's a lot going on over there.
And you answered my questions. So
Okay.
Thank you.
Just for the,
You mentioned that you have some people starting to get very good at getting grants, on how aware of all the grant applicants. Do you have a process maybe where you sort of tell our grants person, hey, here's some more grants for you. You need to look at these.
Yes.
Let us tell you about this one, et cetera. Do you do that?
So there is one of the first things Tracy did when she joined us 6-8 months ago, is create a spreadsheet. Oh no, actually Jordan did this. I gotta give Jordan credit. Jordan and Tracy has picked it up. There is a giant spreadsheet with all the grants, with all these columns and rows on what the timing in the year of every year, and what type of grant, what's eligible, what towns, because some towns are eligible for some grants,
That's good.
some not. So that is, again, we're not sending it out to the public. We send it to someone like Jill, the town manager, the first select people. The people that need to know are
Right,
getting this
right.
information.
So Jill
that does
probably-
exist.
She has that probably,
I would
Jill.
say so, yeah. Someone in the Killingly has it, because there must be on the distribution
Okay,
list.
that's very important.
We also created a newsletter recently, Tracy Hansen,
Oh.
3 or 4 months ago, which is on our website for the public to view. It's really intended, the audience is for leaders and their staff, but it's some really good information. You want to see what's going on behind the curtain, and grants is one of the topics. There's often, if there's a grant date coming up, that goes on the newsletter. Don't forget your grant for such and such a transportation grant or a steep grant or whatever. That's also located on that newsletter, and that goes out to all the leadership of all the towns.
That's important, to all of us to be fully aware of, as you said, all the opportunities available. So, yes.
Communication is the key, and we have great tools now. You've got to use them, and somebody has to be pulling the levers and setting things up. You got to maintain that website. If nobody's doing that, and for years, it was on and off at the Council of Governments because there weren't many people in the organization. So you have to have the folks.
no, not a question, maybe just stating something that you mentioned. For everyone's information, our website is linked to the Northeast Council of
There you go.
Governments, and your website has a great deal of information just going through now and including your strategic plan, with the only, I think mathematics is where I would send you back to school, because it indicates that there are 9 pillars, yet you've got 10 listed.
Okay, we're growing faster than I even know.
Strategic direction and action plan
Yeah.
page.
So
But
it's
anyways, excellent.
It's a living document, that economic development plan. It's something that's to be built on. So we started with the foundation of just a lot of data. So it's like a dashboard of everything you would ever want to know about all of our towns. So that's kind of the foundation of it, but you're supposed to be adding to it over the years. It's not a one and done. You keep changing that document and building it. And again, town by town, Killingly, the more engagement that Killingly has with us, then, Jill is very engaged. She speaks with Jordan regularly. I say every week we're talking to Jill.
Okay.
Yeah.
Ask Jay Lee if she wants any questions. Ask Jay Lee if she's got any.
Well, I try. Jay Lee, can you hear this?
I can. Am I allowed to say anything?
Yes, if you have questions, get them
Yes.
out.
Are you sure?
Absolutely.
So, okay. So I was just curious because the last time we had a meeting, it was with the borough and they had mentioned having funds. For any of the transportation projects, are we able to connect with the borough on that?
We don't directly deal with the borough or any of the boroughs
Oh.
or city boards. We deal with the town. So, I mean, we could, I mean, they
Okay.
certainly could reach out. It's part of the community. That's a good question, very good question, because we do have, I think, a few of our towns, Putnam, Killingly has, a different organization that's representing part of, specific part of the town.
Yeah, that's-
But that is a great question. And again, off the cuff, if the borough president reached out to me or my organization, we're gonna serve them like, as if they were the town of Killing. I'd probably check with the town manager first, make sure he's okay with that. But I would expect he'd say, yeah, give him all the help that you can. So I would say if Putnam City District or Killingly City District asked for help, assistance, or in any area, and we could provide it, we would do that as if it was the town.
Yeah.
Great question.
That's simple.
Never
Because
never thought of
I
that.
think she said they have like 1.8 million in funds, if I remembered the number right. I might be wrong.
I'm not sure I understand what that is. Who has the $1.8 million?
The borough.
The Danielson Borough,
Oh, they are,
they have a separate government.
yeah, they're
Budget.
separate taxing
Yeah, they're
authority, yeah.
separately taxed.
Yep.
Stuff like that. So you could work with them.
Oh, absolutely,
Okay.
Again, sometimes there are grants that go to specifically those types of districts. And Willimantic is that taxing district within the town of Wyndham. And there were grants that would only could only be picked up by Willimantic. And in the case of Wyndham and Willimantic, it's one form of government. They're the same town manager manages both entities. And Killingly, they're separate. In Putnam, I think they have separate
They have a
separate leadership,
service
yeah,
district
yeah,
in
service
Putnam.
district.
Yeah.
So, but that is a great point, and I had not thought of that maybe they're being left out, and again, whoever the president is there, or can reach out to me as a starting point and see what we can do for them.
Jay Lee, do you have any other questions?
That's it. Thank you.
Okay. Gentlemen, ladies, any other thoughts, questions? Thank you. You've given us some good ideas here and there.
I'm glad to be here. And by the way, you all ask very good questions. They're all great questions, and if you need any other help with your work, I know you got a big task in front of you.
Excellent.
When we have our report ready, do you want to print it for us?
We have a copy here. We'll push the button. I don't know if we're going to bind it for you. We used to have that equipment there, but just not as much as on paper anymore. So everything had to be. We used to generate a lot of regional reports and have to bind them. And I found all this old equipment we were cleaning the office out. Like, we don't do that anymore. You push the button and it goes out by email now. It's not bound.
Thank you, Jim.
Anyway, thanks for
coming.
having me.
We
Appreciate it.
appreciate it. Thank you indeed. Yeah. I just said. Would you like to make any other comments based on anything you've heard?
So I guess I'll be the unpopular one. As far as United Services, I don't remember that organization coming to the budget meeting at all. Because in general, the United Services that was just here, she made sure she said it a couple times how we don't fund them. Well, when we were in budget season, everybody that asked for money and showed up to ask for money, I'm pretty sure we funded. She didn't show up. If you're asking for $22,000 and you don't show up, it's really hard to justify spending taxpayers' money for someone that can't show up for $22,000.
I didn't say anything, but I didn't like her comment that the medical transportation.
Microphone,
I didn't like her comment that the medical transportation is unreliable, because I know one of the guys who who runs Quiet Corner Transportation, that he does all kinds of medical stuff, and they are on time all the time.
We have several different systems out there for medical transportation. I mean, we actually pay with, to KB Ambulance for some medical transportation.
Yeah.
And that's actually a pretty large budget for that. I did like the fact that, NECOG brought up the 150K for the brownfield on Broad Street. I'm gonna look into that a little further, see where that goes. I understand it looks like Killenly needs to do a little better job of actually asking for grants for some of this stuff. I don't know what's available. I'm pretty green to this. And the borough, if they're looking for more transportation, and we need to see if we can link that up to allow the town to say, hey, let's work with NECOG and see if we have any grants out there for funding for transportation internally. We just got together recently with a couple of the downtown business owners last week, trying to work on making sure we have more police force presence in downtown. I think that's something we've lost a little bit. We need to get back. Just writing down a bunch of notes while he was going over things. It's interesting how NECOG's in Killenly, but it sounds like Killenly uses them the least. It's kind of a weird connection in my eyes.
Yeah.
I know that Jim is fairly new
Yeah.
to the position. I had heard comments in the past that the council of governments has not been very helpful at all to Killingley. That's what I had heard before.
Yep.
I think he's beginning to change it a little to become more reactive with the towns, but as he pointed out, we're a big town. He seems to be more reactive than little towns.
Yep.
And he's got a lot of them. We're one
Right.
of 16 or whatever it is, but,
Yes.
okay.
And we're always compared to Putnam, which I find an interesting fact because we're literally double the size. You know, we're almost 18,000, they're 9,000.
It's,
So
In some ways, they do a lot more.
that's what I'm getting at. I figure we gotta do a little bit more due diligence to open our eyes to different grants that are out there for certain funding. We gotta make sure they also know what the impact is too. Some of the things that we, at least from what I've seen so far, we get grants on and then the impact ends up being a negative. Yeah,
Yeah.
yeah.
I don't know where the mayor got that grant for the transportation that they're doing. But if you're a senior, and I'm assuming it's 50 or 55, you have to make an appointment. But they take you wherever you need to go in the town, not just medical appointments. You can get a ride to the supermarket, you know, all that stuff. And they're about to expand it into taking veterans to Providence and to Newington and possibly as far as West Haven. So I don't know where he got that grant, but boy, that'd be a good grant for this town to get.
It would
I think
be.
that was the question that I've been wanting to ask, and I didn't, was when both folks were talking about transportation, who is it that we should be modeling ourselves after? If we get more than just us. I think the question I didn't ask, and you're kind of bringing it up right now, who is it that we should be modeling ourselves after in terms of just a place to start? I know Putnam's got less people, but Putnam also feels very much more condensed
Yeah.
than we do here. We've got
Yeah.
miles to go to get one person.
I think we are a lot larger. I think we're 33,000 square
Yeah,
acres.
something along those lines. So
Yeah.
the routes are, it's
Yeah.
easier to run transportation when it's a smaller area, but nonetheless,
Absolutely.
it doesn't mean that we can't look at them or somebody to model ourselves, because you hit the nail on the head with grants. It's one thing to get them, it's another thing to get a return on the investment.
Right,
And-
'cause-
And we see a lot that maybe do 10% of the job.
Right,
so to
I don't
speak.
wanna
And I'm
sit
not
here.
knocking them or anything, but.
Yeah, I
that's
don't wanna
just-
point fingers, but see, some grants we can get, and say if they get, let's just throw numbers out there, $25,000 to a grant for a certain organization, and then the type of audience we get from that grant costs us $50,000 somewhere else. It's not really a good return. I want to make sure that at least whatever I can do to bring to the council and let them know if there's a way of transportation, that seems like a kind of a home run.
That's the thing that I've been hearing the most of, and the ability for people to get around and the impact it has on social health, mental health, work
Yeah,
capability, et cetera. I think if I lived in a community that provided an efficient, flexible, just short of Uber
well,
mentality, that you might be having the kind of community that you want to live in.
yeah.
I mean,
I think we don't ever interview any group that transportation doesn't come up.
And it does, yes, could be
Stuff-
moms,
Stuff for
whatever.
youth in the town, that always comes up, you're talking, you just mentioned police presence downtown. When we interviewed with the church group, remember? That was one of the things that the church groups were about, is particularly women don't feel comfortable being downtown in the evening because they don't see cops ever.
No, I've heard people that don't want to walk from Deer's Gymnastics over to New York Pizza without driving. That's
Yeah.
1 block.
Yeah,
There, you can see line of sight from one to the other, and they don't want to walk.
yeah. I know.
I go to CrossFit right in downtown Daleton. I was literally running down the street as part of my workout today, and just, it can be less desirable at times.
But transportation is definitely one of the bigger items that comes up.
Yeah, we'll have to figure out how to model that, because, it always comes down to money. Where's the money come from?
Yep, absolutely. That's why I asked about the grant, where Barney Sine got that grant, because they're not turning people away. They must have got a pretty good grant. They're talking about expanding the issue, not consolidating.
Well, we're talking about a topic that could be a legacy topic. Out of everything we've been hearing, that's one of those things that you could probably impact the most amount of people.
Oh, yeah.
In terms of what was the benefit or the outcome of having a committee like this. Because that's something, to my mind,
Yep.
can be carried on no matter who the committee, no matter who the town council is.
Yep.
Whoever the town manager is. It's like I said, truly could be a legacy item.
One of the items that comes up is things for the youth. Well, if you live in one part of the town and like he mentioned about Owen Bell Park, if you live in another part of town and you don't have a way to get to Owen Bell Park, it's not doing you any good. The seniors, there's a pretty good senior population in this town. Seniors, that some of them you get to an age where I'm not there yet, but your kids take your driver's license away from you. I mean, there's seniors that need transportation. There's youths that need there's people in this town that transportation, like I said, it comes up all the time.
So let me ask you, if you don't mind, how would you propose it to be funded? Would it be per ride, or some kind of voucher, or, because I don't, in my vast little world, I can't picture it being completely just free.
No, I don't think you could have it completely free.
So-
I know that right now, I mean, I don't use the bus system that goes around town. Are those rides free?
I don't know.
They used to be, and, I could pick one up at the end of my driveway. I just haven't, but I like that security. I was gonna mention a city to model after. We're not Providence, where I came from. They've got RIPTA, which has, takes care of buses for the entire state. But also within Providence, they have specialized trolley routes that would go up to Federal Hill, down to the train station, down to Water Place Park, and other transportation distribution hubs. And no, it's not free, but it's a minimal cost and less expensive than the buses. And they may have, I don't know their economic model now, but it's something that could be looked into and get a grant to subsidize the portion, and then maybe 50 cents or $1 a ride to go on that loop. But because it's a constant loop, it's dependable.
Yeah, I
And
mean,
that's the challenge, because that's not what we have here.
Yeah.
No, I know.
It's, you know, you hit the nail on the head, and I think about people who just need to get some food once a week, let me
Yeah.
get to the market.
You know,
I think about kids, the number I heard today, which kind of surprised me, there's 7,000 people under the age of 18 in this community, and that represents, you know, roughly 25% of, you know, of what we're gonna be working with. Granted, a lot of them don't need rides quite yet, but when I hear about programs about being able to go to learn how to become a worker or an employee, but you can't get there. To me, I think that's something that, no, should not be free. I agree, but, you know, it should be, because I do think if you pay a little bit, you're less likely to abuse it. But I do think it's something that we really should try to take a hard look at as a community.
you
about how do we
should, you should
do that.
try to keep it as,
But the first thing is to understand, Jim said about marketing, understanding your market.
yeah.
We're gonna create this system, we find out there's really 700 people who use it. Is that
Well,
really
that-
what we do?
yeah.
There's gotta be that upfront money to do that kind of study, but I think at the same time,
Yeah, I think your first grant would have to be just to get the system up and running. People would have to pay for the
the
rides.
study of it.
But you would, we would hope you could keep the rides as cheap as possible.
Right, so my first impression on that wouldn't be the grocery store. The reason why is because you can get delivered food. For the most part, you could do some kind of like,
DoorDash,
like
whatever.
DoorDash or something like that, get groceries delivered to your food, you know, or Instacart or whatever like that. My thing he brought, actually the first lady brought up that was pretty unique is, you know, by and large, I feel like youth, less and less people want to take on the ability to drive. One, because it's a huge liability as far as cost. Like, as soon as you start driving, now you gotta buy gas, you gotta buy insurance, you gotta buy registration, you gotta have a car, you gotta maintain it, blah, blah, blah. Goes on and on. So it's like, why would I wanna get a job? Because now I gotta take on this thing that costs me a fortune that is the job. How would you plan like a route for people to go to work? I mean, inherently, into a city, that's what this primarily used for in the first place, is to
Yeah.
get back and forth to work. So, you know, what would that look like?
He mentioned that he is getting extra transportation, didn't he? In a grant that has just been approved or almost approved, that isn't he adding to his transportation?
He's
hub?
getting new buses.
Getting
Yeah,
new
that's what he
buses,
said,
but
yeah.
I thought there was more of a replacement program.
Yeah,
I think my first recommendation is, or no, just thought, it's not a recommendation, is to, my first thought is to spend some money to understand the need.
yeah.
Because granted, a lot of folks that we talk to are looking through a fairly narrow, focused is a better way of putting it, focused view. And they see the constant thing all the time and to repeat. And it may seem like it's a bigger need than it is, but it's the same faces that are showing up all the time. But the transportation has just come up too many times,
Oh, yeah.
just too many times from too many different
It's an issue
type of
here, yeah,
people.
yeah. Let's see, Jay Lee, do you have any other thoughts before we move on?
Thank you for asking. Nope.
He said no.
Good. Thank you for staying, and thank you for getting involved afterwards.
Absolutely, that's what I'm here for. I didn't come to sit in the back row.
I hope some of the information was,
Yes.
I've got a quick question, actually, if I could.
sorry.
You
No.
had encouraged us to vote on the 9th for that school budget. I'm curious, what has changed, I guess, specifically in that budget? I'm assuming it's not just the same budget placed forward, so.
It was reduced.
Okay.
yeah, at this point, yeah. Yeah, I hope some of the information was helpful to you tonight.
It was helpful. It was definitely enlightening on some of the stuff that the grants, and I picked up on one key word. He felt like some of the personalities didn't line up, and that's the reason why some of the grants never were applied for. I will learn more about that in the future.
I think the thing that we have that's completely off topic here that we have talked about and been waiting a little bit for council involvement is how to make sure what we come up with isn't just put in a drawer. And that's a challenge that we would be looking for your help and the council's help for, how do we create a document that can surpass you
Yep.
surpass the next administration, whatever it might be.
Yeah.
The
You know,
first-
it's one of those things, we have the comprehensive plan, I know there's a different term for it, the PCO, whatever it might be, and that gets put on a shelf. Versus what, I think what we really, and what I like about this, is that we're hearing from just everyday citizens.
Yep.
You know, and getting their thoughts and opinion, and one of the things that we heard was, this is great, we're having this committee. So, going forward, as we put together our packet, we would really look for your feedback.
Yeah.
And to make that, how to make that happen.
Yeah, it just made me think for a moment, we're doing Dyer Street, all the sidewalks, right, as part of today, the budget that's coming up. And I think it's Dyer Street. It makes you wonder, did we miss on a grant there or what? Or did we just not get it or what? Interesting questions.
Yes, absolutely.
We need to do the review.
Yes, that's why I know, that's why I said.
Thank you, gentlemen.
Thank you for
And ladies.
coming. Okay. Very quickly, in 2 minutes, 1 minute, Paul, the high school was fine. We got a whole bunch of, and Paul, you can, of input that we will input into our system, okay, from about 15 students, something?
Yeah, and we clearly, we marked them clearly which ones were students, so I think we tried to take care of that, the fact that we had 0 for respondents, and we actually had a bunch of different types
Yeah.
of students that responded. It was actually, it was a good day, it was part of their wellness day, so it was
Yeah.
people just walking
Yeah,
around,
right.
et cetera, and then Frank and I went into marketing mode, and
He was very good. Paul would go to the student and say, I want your input, tell us.
well, mostly you look like you have an opinion. The kid doesn't have an opinion, but actually, I think a lot of them appreciated being asked. And it was a lot of real positive thoughts about what they like about Killingly, which was
Good.
which was
Yeah,
good.
absolutely.
And then I think we had probably another 10 or so take the QR with them, so I was hoping we get a little bit more.
Yeah,
So I think
number of them took
for
it.
the hour and a half that we were there,
We'll see
it was
about
well,
getting that in.
well worth it.
I thank you, Paul, for doing that. Okay.
It was fun, actually.
Yeah. Jay Lee, very quickly, you have 1 minute. How did that go with your Barks and Blooms?
It was again over 1,000 people. One of the ice cream trucks didn't come, so they broke on the way there, so that was a little bit sad. I got to be a judge, and I got to judge all the cute doggies, and it was a really great turnout. We're already planning the next one for the fall. Thank you for asking.
Okay.
One last follow-up, we have an appointment with, we do have an appointment on the 17th with Spiral, with the,
Oh,
yeah, with the HR person, to just kind of go in and do a 40-minute interview. So that's coming up on June 17th, so if it's something that, you know, somebody else wants to join me, it's, you know, I'll
Okay.
give you a copy of the letter that we sent them in terms of, to prompt some discussions, and we'll see how that goes, and see if it's worthwhile maybe reaching out to a couple of other companies to just get their input on what
yeah.
they see, what they feel.
Okay. Very quickly, you all saw the ads, I hope, that went by. I think it all went well. That's excellent. Thank you, Richard. And we have one going in for the June 6th meeting, telling them the last time you need to come, okay? So we'll do that.
I want to
that's,
interrupt 1 second just to let Jay Lee know that the ad that's going in is not the one that Frank held up, but it's
No,
the
no, it's
one
the-
with
sorry.
the train.
It's a very nice ad that Richard did.
Well,
which
Jay
has,
Lee was the
Don't
one
get
that
left
kind of,
behind. You need to come in to that
I
meeting
gotta
on
see
June
that.
6th.
I'm
Yeah.
excited to see
I
it.
give her credit for the graphic.
Sorry.
I give Jay Lee credit for the graphic, which is why it changed.
Okay, thank you. Very good. Okay, folks.
Thank you, Richard. I get credit for something. High five through the phone.
Okay. We'll quickly move on. Last item, and other than to say, I made a main error. We are in the budget for the coming year, if the budget passes. No, the town budget is passed. We're okay. It's the education. So that's very nice, and we thank the council and the others for including us for another amount for the next year, which is great. And we'll use it. Thank you again. Okay? One other quick thought before we move on. I think we've reached the end of data input other than Spiral. okay, which is coming up. And I'm assuming, and I hope everybody is in agreement, that enough data. No more other groups, no more, unless you can think of a group that we absolutely should have gone with. But I think we've covered 30 to 40 of them.
I think at the very least, we have invited everyone, and those who couldn't make it, you know, we
Yes,
can't-
a couple couldn't do it here and there.
Hopefully, we get a
That's
good
okay.
turnout on the 6th
Mhm.
at the public thing, which I need to know who's gonna be there.
Microphone.
That's the next topic on the conversation.
all right.
It's coming right up, okay? But just let you know. And so my only suggestion is for the June meeting, that the only reason is that we start formulating how to put this report together based on the data that we have. And, okay, how are we gonna do that? That's the next big step. That's, in my opinion, the only topic on the June meeting. And one small thing that I did speak to town manager, et cetera, we have so much data, so many different areas to look at. We discussed, think about it, that when we look at the data inputting, if we could get small groups of about 4 people, that's acceptable, since that's less than a quorum that's working on a project, so that's okay legally. To each start working on one topic, instead of having all 9 of us working on the same topics all the time, just to speed it up a little bit. We'll talk more about that next June meeting, if that's okay.
Okay. I won't be here for that. I'll be actually out of country. I'm only telling you that to acknowledge the fact that doesn't mean you volunteer the people who aren't there. That's how a lot of things happen at work. So, you know, suddenly I come back and I'm in charge of 12 things. But
Okay.
I'm only making a joke, but.
Excellent. June 6th,
Yes,
1. You are getting,
I'm getting the
Food.
food and I'm
I'm getting some sodas and other stuff and some cookies. So we're organized there,
Yep, we
okay?
just need to know who's gonna be there
We
to
want to
help
know who's
out
going to
that
be
day.
there. That's important.
That's a maximum of 4, or is that that's a special meeting though, right?
Yes, it is.
That's a
So
Yeah,
special.
it's on Saturday, June 6th, starting at about 11:30, lasting till about 1 o'clock. We have advertised, I will, next Tuesday or so, go to Winnie with an ad and ask them, we'll pay them, to also advertise it on the radio, okay? Just to make sure that as many people know as possible. Other than that, I've spoken to Chris, she says she can probably help us record the meeting, so that should be come. If she cannot come, we'll have a mic, she'll make sure we have a mic, okay?
So,
So we covered food, we got there, what else?
we-
Last question, any other than, all of you that can come, it's a good idea to come. If you cannot, that's understandable too. I know that you'll be there, I'll be there, other folks.
I'm not gonna be in town, so I won't be able to be there.
Okay,
Oh, we were
that's
counting on
okay.
your
I
radio
know, I let
voice.
it, I know, yes.
Big
you-
booming radio
I-
voice to
I-
keep everything
That's okay.
You got it, Paul.
live.
that's
I'll be there.
Thank you very much, Sarah. Richard, you won't be there. Jay Lee, will you be able to make it?
I spoke with Shauna from Sugars, and she said she can do sandwiches for $100.
Ah, okay,
What?
She really wants Sugars to sell sandwiches.
yeah.
We're doing
If I
pizza.
can do that,
We've
then
got
I will
pizza.
definitely
Doing
be
pizza.
there.
We're doing pizza.
We're trying to keep it as simple as we can, Jay Lee.
But I can be there and I'll bring the banner.
All right,
So we'll be sure you're gonna make it, Sarah can make it, you'll make it, Fred will make it, I'll make it. I will check with Glenn and Cody as to whether they can make
Yeah,
it.
okay.
But we have enough people there,
All right, and
yeah.
you said it's from what time?
I suggest I'm gonna be there at about 10:30 to set up for 11 to 11:30 when it starts. What did we put on the ad, 11, Richard? Oh, wait a minute, it said it here. What am I talking about? Excuse me. Meeting of the public line, Westcott Road, 11:30, we said.
11:30.
That's when the public, I want to be there, I think we should be there earlier to set it up, make sure it's all
Well,
organized.
I don't think I'm gonna bring the pizza there at 10:30.
No,
if
no,
the
no,
thing's
no.
not
We can
starting
have
till
people,
11.
we can get the meeting going, and then
I'll bring the
you
pizza
can run
for.
off and go get the
No,
pizza.
I'll bring it for 11:30.
Our liaison person is very welcome also to come. He's not here, okay. Anything else about the June 6th meeting that has not been covered?
I don't think so. I think you open it the way you did last time.
Yes.
Which I
I
think
can
set a
open,
great tone.
Glenn had last time said that, I think Glenn said, he would be willing to sort of be at the table,
Sure.
that I don't take all the questions, and he would do
No, I
that.
think
Or
that-
anybody, I don't care, anybody else to do it, I'm perfectly happy.
I think the point I was trying to make was you open it up with an apolitical statement, that this is an apolitical environment. And listen with respect, comment with respect, courtesy. And I still remember and talk about, it was a blast to watch people just listen to one another, express their opinions.
Yes.
Not in a and you kind of set the tone with that, and certainly, you kept that in mind. I just
I'll
wanna
do
make
that.
sure we.
A little
we go with
opening-
that.
a little
We lead
opening
with
up.
that.
Yes,
Again, I
yeah,
really
oh,
do think
perfectly.
that
I will do
helped a
that,
lot.
Paul.
If,
Excellent.
like last time, if we get 1 or 2 mics, I don't have a problem walking around.
No.
Yes,
And
oh, no,
if-
no.
And if somebody gets nasty, I don't have a problem taking the
I
mic
think I
away
had
from
the
me.
yellow, I was in charge of yellow cards and red cards. And, so I don't mind if we do that again.
Okay,
No, that's good too.
yeah, it's, are we,
It'll just cut their vocals will be gone,
Okay.
like while they're talking.
But I did like, I'm a soccer guy, the yellow card, red card, felt,
I'm just.
I saw enough of them, it was nice to do them. But
folks, we did a lot, we heard interesting information tonight,
Yeah,
and
we
we're
did.
gonna now start
the
moving
sleeves
on
go
to
up.
the next phase of
Yeah.
this big project.
Yep.
Thank you all for coming, thank you for coming, appreciate it, thanks, guys.
Yeah, I think you have to adjourn.
Yes.
Movement to adjourn, right?
Oh, motion to adjourn.
I make
Second.
that motion. Second, we're all in favor.
Aye.
Second it. Thank you for reminding me.
Aye.
You got it.